G'day guys, I'm going to show you the alternative to back surgery. I'm going to fix Jason's back and I'm going to show you how we do it so you don't need to go and get surgery. We're going to avoid that alternatively.
Awesome.
We've got Jace here. I'm Das. Let's get you on the table, man. I'll show you how it's done.
Yeah, fix me.
We have a little draping towel for that. Jace has actually got a little bit of right side lower back stuff, so I'm going to treat him like an actual client. I'm going to show you if you came in with lower back pain, how we treat it and how we fix it.
Yeah.
Okay, so I'm going to get my wax myself up. Okay, so first of all, I'm going to start with this pisiform connection straight in and down into that laminar groove, or that SI joint, almost probably just above it. It's like L5, S1. Probably the most common spot for disc bulges. So this video is going to show you how we treat and look after somebody that has a disc bulge. Look, they're not in the acute stage. You're not in so much pain that you can't get up out of bed or you're taking meds every day. This is for somebody that's got lingering back pain. They've gone and got an MRI. Their doctor's told them they've got a disc bulge, and then they're holding on to that and they're thinking, oh, right, I've got a disc bulge. I can't exercise. I can't perform. There isn't much alternatives. And they're probably taking over-the-counter meds, which is poisoning their kidneys, poisoning their livers. And overall, just a band-aid approach, isn't it, Jason?
Yeah, that short-term fix that's not good in the long run, especially like continually pumping that sort of stuff into your body. It's probably doing you more harm than good.
Yeah.
So, yeah.
So just to go over what I'm doing here, I've hardly moved. I'm going pretty slow. I'm not overdoing it. If you do have some, if it is more acute, then we probably just want that touch, that connection phase to even maybe sit a little bit longer in that first position. So I'm just going to get rid of that stroke, and then I'm going to start again and probably sit sort of down like that, use both hands and push down. And Chase, is that?
Yeah, it feels good. That's connected
pretty therapeutic.
Right into sort of that sacrum, lumbar junction.
Yeah.
And yeah, it feels really that bony pressure that Ninja always likes to talk about, that therapeutic connection with the bone.
Yep.
And it sort of gives that sensation of knowing it's in the right spot.
Yep. And I guess when you've got these disc issues, this is encouraging the disc back into the right position. And we're probably working right on the spots where that nerve is sort of breaking out. The muscles are compressed, the muscles are tight, solidified. The fascia in this area as well is quite dense. We're just trying to soften and melt it, maneuver it a little bit. You can sort of do these little shimmies and changes of angles and pressure. It's a bit like a joint mob as well as a stroke. And just encouraging, that disc back into a neutral position. All right, so I'm going to follow that down. When you do have this back pain as such, you will get a lot of referral symptoms down the leg, into the hamstring, sometimes goes into the quad or groin. It's different for every person, but it is important that they know that you're hitting the right spots when you are getting those referral points. We're sort of affecting those areas.
Yeah, releasing the tissue around that nerve root that might be getting compressed or...
Just to speed it up, I'm going to get out of the... So for somebody that is, got this acute back pain, I would spend a little bit more time with my palm, but we're going to get the big tool out now and go straight in with an elbow. My pressure's not, too much here. I just want to lean over Jace and spear in and down. It is quite bony in there. Jason's got probably one of the more challenging lower backs to treat.
Yeah, the erectors are pretty ropey in there.
Yeah. All right. So just to give you guys some confidence, if you have been told going back to those MRIs or scans and you're feeling disempowered, you're feeling like, what are my options? You got to give this a go. You got to get some real good deep tissue therapy, somebody that knows what they're doing, and focusing on releasing the tissues, releasing around that nerve and releasing right in next to the point. If it's an L3, L4 or L4, L5 or L5, S1, any of those we can understand where that is and sort of target those tissues right next to it and soften them, melt them down, melt them away, get you off those nasty meds. And the reason I'm doing this video is because I've had some good success lately with people with disc issues. I had somebody just on Wednesday that had had it lingering for about 3 or 4 months. And yeah, she was just smashing Voltarens and anti-inflammatories, and just made me go, look, I've got to show other people out there what your options are. And it was fantastic that she had came in and seen us and was trying this therapy.
Yeah, because there's a lot of people that don't look at that alternative option. They just go see a doctor and they go, oh, the doctor knows what's best, so they just stick to that medical advice. That's it. They just.
So this is for you, or maybe it's for your mum, or maybe it's for your auntie, or whoever it is. I think I was reading some stats because I wanted to have a quick look and do some research before I did this video.
Oh yeah, that's a good one.
And 90% of people with disc bulges, whether that's in their cervical, which is common, as well as their lumbar, so neck or lower back, recover. 90% of people recover naturally. It's the 10% that do need the surgery, where they go in and cut it out or do whatever they do, fuse it or create more space in the vertebrae by cutting off the bone. But for that 90%, why not try and fast track? They say there's a 6-month gate or 6-month period where it'll take for that disc to heal. So why not try and fast track that 6 months and start getting some really good quality deep tissue treatment to alleviate pain, alleviate symptoms. I'm not saying we're necessarily going to fix it straight away or the first go, but why not try it? Explore your options. Do something that's holistic, something that's natural, something that's good for you, and you are going to feel better. There might be, I guess, a day or two where you're quite tender, or maybe worse for wear. Everybody's body's different. But most of the time, the experience of this is going to be good. And you're going to feel much better. So, telling you what I'm doing here, I'm hooking in and down into the QL. So this is where Jason's feeling some symptoms. I'm going to focus a little bit more on my treatment here rather than trying to give you some stats.
Oh, I like the stats, Darcy. You've done your homework, yeah.
Did me homework before I got out and started getting into it. Yeah, that's good.
Ooh. Yeah, feels good in there.
Yeah. Oh. So I'm probably more QL here.
Yeah.
So that's usually the main culprit for lower back tightness, getting into your QL. I like to say it's a bit like the size of a Scotch fillet or a steak. It sits perfectly under your last floating rib and in between your hip bone or your ilium here. And I'm just sort of like tenderizing it, but I'm still staying connected to his ilium, and then I'm going to finish that stroke.
Yeah, that's good.
Out and down.
Oh,
what I like to do is do a little bit of a decompressing stroke as well. A lot of people you'll see, because of our day-to-day lives, bending forward, picking things up, squatting with not the right biomechanics or performing properly, their lower back, it's the opposite to that. Our lower back flexes, and these people are more susceptible or more prone to having these disc issues and then they pop their back out by, picking up something really light, but it's actually because of the stuff they've done previously without actually focusing on using their legs, using their glutes and hamstrings and their muscles around their back to help pick things up. So there's actually a cool little exercise as well that does encourage fixing disc bulges, and that's called a Mackenzie's extension exercise. I can't remember what year this physio, but I'm pretty sure, was it 1900s? Who was the physio that came across the Mackenzie's? His name was Mackenzie.
Pretty sure it was Mackenzie. His
name was Mackenzie. There we go. I had to do more research.
He's done well.
I was on the right track. I've got enough guys in this room to help me. So he was a physio who actually accidentally put his client on a bed, and he'd had the bed adjusted where it was putting his back, as Jace was showing you, do that extension, right up like this. I think the bed was, jamming this client like this, and this client had a disc bulge. And after leaving this client like that for maybe 15 minutes or 20 minutes, they came back in, and this client's symptoms had completely alleviated and had basically fixed this client. So this physio went and did his own research and started to treat people in extension, or started to give people rehab exercises in extension. So that's something that you can look at doing as well, and that will be maybe the second part of this video. I'll show you guys Mackenzie's extension exercises that you can just start working on daily and creating more extension in your lumbar spine.
Oh, that one feels good going up that way, Das.
This is just a nice decompressing stuff. So when our discs are jammed and short and compressed due to a lifetime of wear and tear and degeneration, we're working up the back, decompressing.
Oh.
A lot of people actually will have disc bulges, but they are asymptomatic and they're not even sure they've got one, and then they go and also get a scan. Just to give you another story, they get a scan and then they hold themselves to that issue. Oh, I've got a disc bulge. I can't do that. I can't, I can't do deadlifts. That's the worst one. I can't do deadlifts. I can't squat because I've got a disc bulge. Start strengthening your back and see the results. Start getting good therapy. Release the muscles around the back before you start saying, I can't. It's more about what I can do, and I'm trying to encourage you guys out there. See what you can do. Right, I'm going to sit a little higher now. Just going to finish off here, but this would be a little higher, somebody for L3, L4. This is like encouraging that disc that's jelly donut has popped out. It's not completely
obliterated.
Yeah, it's not completely herniated or ruptured. It's just come out a little bit. We sort of want to encourage it back in and just alleviate those nerve-like symptoms wherever they go to. If you're getting it more into your groins or into your, even sometimes your genitals, then it's probably a little higher. L3, L4.
It's good to ask
that.
It does.
Genitals is okay.
It does sometimes go into the genitals.
Yeah, sometimes it. You like that, Jace?
Yeah,
Stay still, mate. I'm going to hurt you. Tell you what, is it 50 degrees in here, or did it just get hotter because I started talking about genitals?
Genitals.
Always get you going, Oh, I love me genitals. Anyway.
Someone shut him off.
We're going to have to cut that. No, that's all right. Look,
keep that in.
I'm going to finish up here.
Oh, thanks, us.
Giving Jace just a little go. There are different areas we can get into. We can start hooking into the glutes. These are going to be more symptoms. If you've got sciatica and it's not a disc bulge, we'd get into your piriformis and start working deep into the glutes where the nerves are becoming entrapped.
Oh, he's just hammered that one.
Yeah, give Jace a little bit of curry on his ass. He loves it.
Oh,
how's that for dolphin skin? Have a look at that. We've just completed our 8-week advanced course. So we've been building, getting strong, using our glutes. So Jace is going to have some tenderness and some tightness, but yeah.
Thanks, Das. Fixing me up.
Let's finish up. All right, guys. Thanks for watching. Stay tuned. I'll show you the Mackenzie's extension exercise downstairs in the gym. Alrighty, so we've made it down into the gym. I'm going to show you an exercise that you need to do for 3 or 4 minutes a day. You're going to avoid that surgery. It's called the Mackenzie's extension exercise. I'm going to get Jace to get on the ground. All right. I'll show you how it's done. So, Jace, show us extending this part of the lower back, keeping our hips neutral and pinned to the floor. So in this position, you can hold for at least 3 or 4 minutes. You can watch TV. It's not something that's too advanced or too hard to do. We don't need any equipment, but it is super effective and you're going to avoid surgery. So, Jace, show us some progressions and some aggressions, man.
Yeah, so if you're struggling to hold this position, you can just give yourself a little reprieve and then come back up. So the further your hands and elbows are out, the easier it is, the less extension you're going to have through the spine. So if you're feeling like you can work yourself up a bit more, then shuffle your elbows back, and then we can progress onto hands. So have them a bit wider to start with, and then again, you can go back down and then come back up. Again, the hips are staying down at the floor, they're not lifting off, and then back down. Then we can shuffle the hands down, and this will be probably the most advanced one. We're extending a bit more.
And how long is that going to take until we get to that position, Jace?
It varies from person to person. So yeah, it might take you a few goes to get to this level.
Yep.
But yeah, just go with what you're at. As you feel those neural sensations diminishing, then you can start to get a bit more upright and a bit more extension. But yeah, you might need to give yourself a bit more of a reprieve with this one because you do get a lot more extension through the spine, so you can sort of feel a little bit of a compression. So yeah, just go back down flat, give yourself a little bit, and then you can come back up.
Yep.
Okay?
And localized pain in the lumbar spine is fine. We're encouraging that. We're encouraging the disc back into its neutral position. All right, it's flexed out, it's protruded, it's herniated, you're getting all this neural pain. We need to get rid of that. All right, so give this a go. You'll be fixed. You'll avoid surgery. Thanks for watching. Make sure you like and subscribe.
Thanks, guys. Done.